Welcome to the Wow MD podcast, where in each episode you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Chernayanu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Hello again, dear listener. In this week's episode, I want to continue the conversation about what is a medical covered expense. And next week, I will continue with what is preventive care coverage, the benefit of investing in the best treatment available, not simply just what is covered, as well as why most physicians are opting out of accepting your very expensive health plan and demanding that you pay a concierge fee if you'd like to use your insurance. As we all know, medical insurance premiums have skyrocketed, and they are extremely expensive. So for many people, they have become unaffordable, or affordable at a cost that's impacting their financial quality of life in a very significant way. And I hear that from my patients every day. That means they have to cut expenses somewhere else because now they have to pay this huge, exorbitant monthly premium for not just themselves, but their entire family. And this is a very hard truth. Most people do not budget anything else outside of the monthly premium, but you definitely should. And I will talk a little bit more about this in this episode. I outlined in the previous episode how you should be aware and know by heart your deductible and make sure you have that amount in your savings account ready to go so that you are able to pay your medical bills as they come and you don't get surprised. But on top of this, there are a multitude of treatments that are not covered by many health insurance plans. So you have to have contingencies to pay for the not covered but much needed health expenses, as there's a very, very, very good chance that anything that's holistic, natural, regenerative, restorative, bioidentical hormone therapy, or any type of therapy focused on maintaining wellness or hormonal balance or anti-aging will most likely not be considered a covered medical expense. So let me talk a little bit about the notion of a covered medical expense. In my not long ago episode about coverage for wellness services, which ended the series on IV vitamin therapy, I discussed how and why vitamins and wellness practice treatments are simply not considered a covered benefit, as in most cases, the medical insurance plan will not consider them medically necessary. And to make it simple, medically necessary is not what you think is medically necessary from your point of view, but medically necessary in the eyes of your health insurance plan is this. Do you have an approved medical condition that has an approved medical treatment? And when I say an approved medical treatment, it doesn't mean an approved medical treatment by a medical entity like the North American Menopause Society or FDA or the American College of OBGYN or American College of Family Practice Physicians. This is just a simple example of entities. It usually means it must be a treatment that's not only just FDA approved, but also it has to be approved by the health insurance governance plan documents. In layman terms, the health plan has a governing board with some non-medical and some medical trained and certified people on it that likely meets periodically and determines what it makes sense for them to cover, making it attractive to their customers, but not enough to lose money. Because instead of making a profit, the plan would lose money. If they cover everything under the sun, their expenses would be too much. Too many customers would take advantage of the covered services if they offer too many covered services. So the plan would constantly function at a loss and not make a profit. Because obviously covering too many medical services and procedures would make the expenses too high, so high that all the monthly premium collections for all the people that have bought that insurance plan will not be covering the plan expenses. So that's just common sense, common business sense. The medical insurance business is a business. Someone at the other end of it is there to make a profit. They come up with these plans, they generate them, they administer them, they run them, they control them, they staff them with medical people. to make a profit. This has nothing to do with your doctor making a profit because the money is not paid out to your doctor. Your doctor is not a member on the board of these plans. It has no decision making over what's covered, what's not covered. Your doctor is simply someone like me that has struggled with the decision, should I go all cash and serve only the patients who can afford me, or continue to allow access of my skills to many more by accepting insurance plans? As a matter of fact, if your doctor takes your insurance plan and his or her practice has no contingencies on how to bring in cash outside of what they get from insurance plans and offer not covered cash services, that practice is guaranteed not to make any profit and likely go bankrupt. More on that in a little bit, but let me stick with the thread of what is covered medical service. Why do medical procedures and services that seem common sense get denied? Because the people that govern and administer the plan, the medical insurance plan that you bought, have contingencies and rules they go by. And remember, the plan cannot cover everything. It will simply disappear and cease to exist, and it will go bankrupt if it does. So the plan has to be viable and profitable, so it relies on collecting more money from clients that sign up for the plan, and ideally pay much less when those clients actually need medical services. Otherwise, there's no profit, right? They probably take into account the fact that some clients buy the plan but never use the plan, which is great, allows them for reserves. Also consider the fact that at the other end of a denial for covered services is usually a person who has the power to say yes or no to the claim filed in your name by the medical provider when you use your insurance. Consider the well-known and the terrible, stupid fact that the person at the other end of your approval or denial, most likely the denial, that person is likely to make a bonus at the end of the quarter or at the end of the year, not based on how many approvals they have to allow services to be paid, but based on how many denials they have processed, because saving money for the plan is the only way for the plan to stay profitable. So let that sink in for a minute. You've had a service, a medical service treatment that your doctor has provided in good faith, hoping that your insurance plan will cover, and more so, you're provided that service without collecting anything from you. After the medical service, your claim lands on someone's desk, someone who is literally guaranteed to get a bonus or be paid more if your claim is denied. What is wrong with that picture? Probably a lot. Maybe that is not quite true in nowadays environment because a lot of approvals and denials are likely going through a software and are possibly electronically approved or denied. However, rest assured that there are financial or other types of thresholds built in so that once a specific type of approval is generated for a large sum of money that's over a certain threshold, it will likely trigger a review by a human. And especially if the amount approved is too high. But sometimes there's human audits that go through and discover mistakes, right? Now, this is common sense speculation. I've never worked for an insurance plan, but this is how I envision it is happening or how I've heard it is happening. So this is pure hearsay at this point. I'm not working for an insurance plan, never worked for an insurance plan, but I've heard people talk about what happens behind closed doors. And this is how I'm making sense of this crazy medical insurance denial for very much needed services. It's very possible that sometimes the doctor visit triggers a review of the notes to determine if the complexity of the visit billed is justified. In other words, this is real fact and the truth. The doctor's office gets audited all the time. The insurance plans are paying different companies now to go retrieve the doctor's notes, and the insurance would love nothing more than to look at the note and say, "Oh yeah, well, we got you. The information you provided does not support the billing category for your claim, so we overpaid you. You need to pay us some money back." So the claim is likely already been paid. The payment sent to the provider. Now the insurance company after the review might say, no, either the claim was overpaid or was denied and paid in error. Sometimes there's zero reason given. And the insurance company demands the money back. And you don't know why there was an error. The computer made an error. They always blame it on the computer. So the doctor is the one left with no payment, trying to recoup the cost of the medical procedure or the treatment from you, who are reassured, hey, my insurance got covered. Hey, what's going on? Everything was okay. Why do I suddenly have to pay you? You could say, well, the doctor can simply refuse to pay back the money. That's not so. The health insurance plans have it laid out in the rules, which they roll out to their accepting physicians, what's called in-network physician, that if an overpayment is made in error or for whatever reason, they will simply hold future payments to make up for that overpayment. So just like a credit card that takes their money back after a customer dispute, even when the merchant has had no chance to address the dispute, the health insurance plan will penalize the physician for providing the medical service by taking the payment back or taking part of it back. And please be aware that your insurance plan does not care about the doctor. They have zero allegiance to the doctor. Their allegiance and responsibility is to their written bylaws and to their executive officers, shareholders, and board members. So I ask you to think for a minute how adversarial this environment is for physicians to practice and to continue to accept medical insurance plans. Also, it is not easy. It's very complicated to accept a medical insurance plan and bill for medical services. That is why doctors have to hire billing companies. They're not billers. They don't know how to bill. They need billing software. They need a platform to submit the billing claims. That's extra. Now they have to pay a percentage that could be as low as 5% or as high as 10% to the billing company. Otherwise, they would likely not get paid or get paid a lot less than they expect. So on top of the meager $100, maybe $200 maximum per medical visit, imagine 5 to 10% goes to the biller. And just to put it in perspective, if a doctor sees about 15 to 20 patients a day and will only see patients under an insurance plan, then a single doctor will likely be able to bring in a maximum of about $2,000 to $2,500 per day if they're working their ass off and sweating bullets. That means the maximum revenue they would generate annually would likely be about $600,000 to $700,000 a year. Think about this for a second. It takes at least 3 to 4 medical support personnel to man the practice on top of the doctor, each at an annual pay of over $60,000, at least for California. That comes out to another $250,000 annually. That leaves maybe $400,000 to cover rent, malpractice, medical supplies, internet, telephone, electrical bills, and so on and so forth. And last, the doctor's annual salary. And this is the truth about private practice. Your doctor always will get paid last if they're in private practice. He or she is always paying everyone else before they pay themselves. Many doctors would make much more money if they sold their practice and retired, or worked for an entity that pays them $250,000 to $350,000 annually for their services, who also pays their malpractice. And there's zero worry about the biller, the overhead expenses, the payroll, the hiring and the firing. But who does not want that? Well, that is practicing corporate medicine. Many doctors love it. They don't like the overhead. They don't like the HR issues. And they don't like leading a team. They don't like dealing with customer service. And they don't like the billing and all these aspects. But many doctors hate it, and they prefer to make less money, but have more independence. Again, independence always comes at a cost. But deciding how many patients you see a day, when do you accept and start seeing your patients, your first patient of the day, when you accept the last patient, who do you work with, who is delegated and empowered to serve your clients, all of these decisions might be priceless to a physician, but come at a very high cost. And many doctors are no longer willing to pay that. So they're shutting down their private practices, or they're implementing a concierge fee. I'll talk about that in a minute, and demanding that you pay their fee. So accepting insurance plans and Medicare is a very hostile environment where a doctor has to take a lot of financial risk to accept your insurance healthcare plan or Medicare. And when you take all of this in consideration, it will make sense that most doctors are implementing fees for the admin expenses that surround your medical service. All the services that require a team of 3 to 4 people per doctor to handle, a biller, a manager, and it's all wrapped up in a membership or concierge fee. So coming back to what is covered, medical service, if your doctor's office, who has billed and has knowledge of billing, because they've done this for a while, including your billing team, tell you, hey, we've billed for other patients with the same insurance plan for this specific service that you require, and the service is always denied as not being covered, then you have two simple options. You choose to pay for the service out of pocket, or you choose another service that allows you to maybe use your insurance plan. It is not that complicated. However, 90 to 99% of patients struggle with what they believe is the right decision for them. In my mind, again, I'm a doctor. It's very simple. I try to simplify things. This is a very simple decision. You have to choose between what you believe will work best for you from a medical standpoint and what you believe you can afford to pay for the best treatment. And ideally, they both work together. Now, since we're on the topic of affordability, I would like to tell you my own personal opinion about this as a woman and a doctor who understands the human body and the importance of being optimally healthy. When the decision of affordability for medical services comes to mind, consider the fact that you might be the major bread earner for the family or the major caretaker for your family, children or parents. Consider the fact that maybe you're going to school or learning to get a new degree, and you need the energy and the mental capacity to process information and be at the top of your game. But you are not able to work as hard or as efficiently as you could. You can't study as hard as you used to and retain and analyze information for a grade, a good grade, or a passing score because you have a medical condition that keeps you tired, foggy, achy, anxious, and distracted. So I ask you, can you seriously afford to feel that way? Can you seriously afford not to be at the top of your game if you're the bread earner, the major family caretaker, or you going to get a degree? Can you afford not to be at your best if your family, your career, and your future depend on it? How much will it cost you to not get a treatment that could help you the most? Whether it's peptide therapy, IV vitamin therapy, hormone therapy, whatever fancy thing you can think that you were told, hey, this might help you, and you said, no, I don't have the money for it. And so I'm going to continue feeling the way I feel. So I got on another thought track with the affordability issue. I want to come back to the original point of discussing what is a covered medical service and use an example when a service is actually deemed covered, but you have to pay up front because you have not met your deductible. So let me talk more about medically necessary so I can give you some examples. You can understand a little bit more on why some things that seem common sense to you that they should be covered will not be considered covered services. For example, you have fibromyalgia. This is unfortunately a rather common and on the rise condition, likely caused by some form of mitochondrial dysfunction that responds really well, believe it or not, to IV vitamin therapy, IV NAD, because these two therapies support, revive, and restore normal mitochondrial function, which is the core issue of fibromyalgia. But IV NAD is not a covered benefit and is not covered by any health insurance plan. IV vitamins can be covered, but usually they're subject to your deductible. So unless you've met your deductible, you will have to pay for your IV vitamin therapy out of pocket. But one of the amazing and extraordinarily effective therapies for fibromyalgia is hormone therapy, specifically estrogen replacement. Testosterone helps too, but estrogen helps the most because fibromyalgia affects many women, especially women, not men. And a significant amount of these women are either perimenopausal or menopausal. So they respond really, really, really well to estrogen therapy. The best response is obtained with a hormone therapy that provides for consistent, steady estrogen levels, like pellet therapy. But many women also get some improvement even with the simple estrogen cream, gel, or the estrogen patch. I know this because I have treated a large number of women with fibromyalgia and prescribed replacement therapy for the menopause symptoms to surprisingly and pleasantly hear back that their aches and pains are much improved or gone completely. This is not isolated evidence. Yes, it is an observational evidence, but it is well known from many observational studies that estrogen helps women manage fibromyalgia pain. However, guess what? Your insurance company will not consider it medically necessary to control pain from fibromyalgia, even though that's significantly impacting quality of life for women. So though in some cases and on some plans, the testosterone pellet therapy is actually covered for women, the estrogen pellet almost never is. So figure that out, because I can't. We know estrogen helps the pain. We know estrogen pellet works best for joint pain and fibromyalgia pain. But your plan is likely going to cover an expensive anti-inflammatory, even an opioid, if it's prescribed under the right category after the appropriate consultation by a pain management specialist. But they will not cover pellet HRT, pellet hormone replacement therapy, or they will say, yeah, your patch might work, but you have to pay out of pocket because you haven't met your deductible. So now at $80 a month, you might end up paying over $1,000 for your hormone patches. So medical insurance companies do not consider hormone therapy as medically necessary to cover fibromyalgia. It's not really a diagnosis that they will provide coverage for. Fibromyalgia is not a diagnosis that hormone replacement therapy is indicated for. They will cover pain medication or anti-inflammatory medication, and they will cover possibly other expensive treatments that address the pain, I don't know, epidurals or other weird stuff, but they will not cover the hormone pellets, the IV NAD. They will not cover digestive health supplements, all of which will likely address the core issue of the problem. Because fibromyalgia, it's most likely mitochondrial dysfunction generated by an autoimmune dysfunction. Let me use the example very briefly of IV vitamin therapy. Medical spas in the medical industry have realized how effective IV vitamin therapy is. And whether it is placebo that makes people feel better immediately, or it is the amazing benefits of delivering the vitamins directly to your cells, boosting the mitochondrial process of the energy generation, allowing you to have improved energy, recover from a hangover, get over an infection really quickly, allowing the mental fog to lift, providing mental clarity, or improving that constant achiness of fibromyalgia and other issues. These are just a few small examples of what IV vitamin therapy can help with, and it works. So just as an off note, a medical office that accepts a health insurance plan and would like to provide you with medical-grade IV vitamin therapy might offer the customer, the patient, the opportunity of using their health insurance plan. Well, let's presume you have a high deductible, $5,000. You get the infusion and you find out that your IV vitamin therapy is covered, but it's about $500. Now you have to pay it because you have not met your deductible. Now you say, okay, well, this is very costly. It's very expensive. So you say, okay, I'm not going to go to the doctor's office to get the IV vitamin therapy. It's too expensive. The next time you decide, I'm going to go to an infusion center instead and pay cash. They're charging me half that amount. I can get a nice IV infusion for $250. Makes me feel good. You are treated there by a nurse or a mid-level staff, maybe even a licensed vocational nurse, not an RN, who is starting your IV, and you choose that from a menu. You select an immune boost, you get a small dose with a limited amount of vitamins based on the menu that you selected. You do pay out of pocket half the price, but you are not going to get a long-lasting effect or as intense a result as a medical-grade IV infusion. More importantly, this is what the example is for. The money that you spent at the IV infusion cash center will not go towards your deductible. But in your mind, you saved money because you paid less. You don't really save any money. God forbid something happens. You end up needing to pay your deductible when you have major surgery or major medical expenses are required because you've gone to the hospital and you were admitted or you had an ER visit. So I'm going to use some random numbers as an example, but as an alternative, should you spend $3,000 on a treatment plan the doctor formulated for you that would have allowed you to use your health insurance plan? Clearly, this $3,000 would have helped you meet your deductible. Or should you have spent $1,500 getting somewhat similar treatment, lesser dosing, quicker, faster visit, more limited vitamins, but you're spending it at a cash infusion center? You're spending $1,500. They don't go towards your deductible. So are you really saving the $1,500 that you could instead put towards your deductible and get better care? Yes, it will cost you twice as much, but if, God forbid, something happens and you need to pay $5,000 at the hospital, now you're $5,000 out plus the $1,500, whereas the $3,000 that you've paid for the vitamins, you only need to owe $2,000 now, plus 20% of your co-insurance, which is another thing. So it's the same with hormone therapy. Testosterone hormone therapy in pellet form is covered for men, but it's covered and it's expensive. And you might get a bill for $1,500 or $2,000. You have 2 hormone therapies, that's $4,000. If you have a high deductible of $5,000 and something else happens, you already paid $4,000. But you choose to pay the cash price, which is $1,500, you save $500, but it will not go towards your deductible because there's no billing done. So this is a personal decision that you as a customer and as a patient will have to make. Everyone has different values when it comes to their health and when it comes to their pocket and the money they want to spend for their health. So this episode was pretty much all about covered versus non-covered services. I do want to go into preventive services and continue this discussion about being independently healthy, as well as why it might be to your advantage to join a concierge practice and why this is not necessarily an unnecessary expense. So join me next week as I continue this last episode in this series of being independently healthy. And I thank you for listening and allowing me to be in your ear for another 30 minutes or so. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas, so please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.